Hello, I'm Dr. Janet Pope, a reporter at Room Now. I'm a professor of medicine and rheumatologist at Western University. This is a talk about reader beware, interpretation of relative effectiveness and safety of JAK inhibitors versus biological DMARDs and real-world data. And the reason I'm saying reader beware will be obvious as I go through some registries. So the RISE registry has over 16,000 patients and with rheumatoid arthritis. And in the oral presentation 0117, they found no difference in disease activity index for active patients that then were treated for their rheumatoid arthritis, comparing TNF inhibitors and non-TNF inhibitor use. However, there were differences within subsets, and that was affected at times by ethnicity and also things like socioeconomic status and possibly education, as the two are interrelated. Another registry found an equal discontinuation rate of tofacitinib compared to TNF inhibitors and rheumatoid arthritis. And this was a combination of two Canadian registries, the Ontario Best Practice Research Initiative in Ontario and RheumaData database in Quebec. And this was oral presentation 0179. So within this database, combining the data, they found that the discontinuation rate over time was the same if a patient was on a JAK inhibitor, in this case tofacitinib, or on a TNF inhibitor. However, we'll move to another database. So oral presentation 0123 had over 3,700 RA patients from the bDMARDS registry. And what they found was more serious infections in the JAK inhibitor patients versus the bDMARDs. They found more herpes zoster, which other databases have found, but many other databases found serious amounts of, they found the same rate of herpes zoster as other databases have found, where it was increased in JAK inhibitors, and this is what they found compared to bDMARDs. However, they found more serious infections in the group that were on the JAK inhibitors compared to bDMARDs. Many other databases, including Corona database, hasn't found that. So I wonder if it's related to line of therapy. If you're later line therapy, you often don't do as well, and you also have often more serious infections and other problems and higher dropout. Then I think the icing on the cake when I am saying reader beware is looking at the jackpot study. So this was poster 0093, and this was looking at 19 registries combined with an awful lot of patients on both bDMARDs and almost 1,000 or more on JAK inhibitors, and it depends on when they pool the data, how many patients are on JAK inhibitors. What they found, though, is looking at the JAK inhibitors, variable response rates related to country. And this would be related to probably access, line of therapy, physician prescribing preference, and also rules within the countries of what is provided when. As if, for instance, biosimilar bDMARDs such as TNF inhibitors have varying prices throughout these countries. So I think what you have to know is sometimes a JAK inhibitor and a TNF inhibitor or other bDMARDs are compared, and one looks more favorable on retention, on safety, on effectiveness. And then you read another study and that's not the case. And I think it's important to put these studies into context because none of them are randomized and they all have potential biases that I've mentioned. So with that, reader beware. Follow us at Room Now and enjoy EULAR 2021. Thank you.